3 dogs going out. A red dog on a blue tree, a blue dog on a red tree, a green dog on a yellow tree. Some big dogs and some little dogs are going around in cars. A dog
Everyone, this is Barb Gino. She's the project director for West Michigan Therapy Dogs. Hi, Barb.
Hello.
And this is Max, right?
This is Max.
Tell me a little bit about Max.
Max is soon to be a 3-year-old yellow Labrador Retriever. He's very blocky and very stocky, but there's a lot there to grab and love.
And very happy.
He's a very happy
and
dog.
you told me he likes to lick.
Yes, Max.
You said he can't hold his liquor.
No, he can't hold his liquor. So Max wears this head halter to remind him of his manners. But yeah, that's our joke. Max doesn't hold his liquor too well.
Tell me how you yourself got involved with West Michigan Therapy Dogs. You have quite an interesting story.
I've always had pets my entire life, and I've had, through every adversity that I've gone through, my dogs have always been there for me. Back in 2004 or 5, I learned about West Michigan Therapy Dogs, and my first dog, Maggie, is a black lab that was trained and registered through West Michigan Therapy Dog. And it allows me the opportunity to share my dogs with other people who are also going through some challenges, whether it's physical or helping them to learn to read, or we do a number of different programs. We volunteer at the hospital and work with children who are coming in for surgery, and I do on-call at the hospital as well for children who are coming in for alleged sexual abuse, and having the dog there during those examinations has proven to be very helpful to the child.
Wonderful.
And then I also do by appointment visits for hospice. So we do a lot of different things.
And you can understand some of this, I understand. You've
Yes.
had your own personal story.
Yes, back in 2000 I was diagnosed, actually with stage 4 lymphoma. And I've been very fortunate that my health has returned, and we've been able to beat the cancer so far.
Fantastic.
But throughout that journey, aside from my husband, of course, my dogs have been there with me. And I'm a little selfish because if I ever have to go through that again, I know that I'm going to be able to have my dogs with me even more because of their training and the certifications that they now carry. So
that's fabulous. What a story. Now, how old was this guy when you got him involved?
Max was 10 weeks old, and we immediately started training him for the things that were basic to a good therapy dog. And I was fortunate in having that knowledge from my first dog. And so we immediately started socializing Max. And he was very good at that. He loves everybody. It was getting his obedience training down that was the biggest challenge for Max. He liked to play more than he liked to listen.
Tell me a little bit about what you start with. How does the training process work?
With socialization, we want the dog out. We want them meeting different types of people. We want them around children. We want them around other, even exposing them to different ethnicity. Because we've had dogs that have not had that exposure that are uncomfortable meeting people of different color. And we get them out, we socialize them to noises and touches and different textures. There's a lot of things that you don't think about with your dogs when they're working. Just like when we go into a hospital, the floors are highly waxed, and sometimes that can be a challenge for a dog to walk on. Different sounds, especially if we're visiting in a hospital setting. There's a lot of medical machinery that's beeping and squeaking and making a lot of different noises.
They have to get used to that and not be startled.
Yep, and then also part of our training, we do a lot of things through the formal training. There's different scents that we expose them to, because some dogs don't like the smell of alcohol or other scents that are in the hospital. And then a lot of our dogs visit medical care facilities, senior residents, and There is different types of socialization and training that we look for in each facility and situation that the dogs visit in.
Fantastic.
Yeah.
I asked this question to Bruce, and he told me that many dogs, many different types of dogs are used in this
Yes.
program, but what type of dogs, in your opinion, are more conducive?
Actually, I like to say we have pit bulls to poodles and little 3-pound Yorkies to 250-pound Mastiffs.
Wow.
And what we look for is a dog that enjoys interaction. You can see Max would lay here all day and let us pet him. And when we are doing that, we're looking at the dog actually enjoys it, not that it is submissive to it, but enjoys the interaction.
Wonderful.
Obviously, I'm partial to Labrador Retrievers, and they are a great
They're just
social
the
dog.
all-around family puppy dog.
They really are. But we have so many wonderful dogs that have come into West Michigan, and you can tell that they enjoy it. They feed off of that positive feeling they're getting back from the individual they're working with. And, you know, I can't really say there's a specific breed. Like I say, we've got every mix, mash, pedigree you can imagine.
And
in the
every
club.
age, too.
And
From a
every
year up.
age, yeah.
That's wonderful.
I work quite a bit with our training program, and we've registered dogs as old as 12 and 13 years old.
How nice.
Yeah.
How nice. What a great way for a senior dog, too.
It is.
What a great
It
service
is.
for them.
And a lot of times they're at a great level of their life that they're just very well paced. They've had that socialization, and they're just very accepting and calm.
And I know that Therapy Dogs is a nonprofit and volunteer organization. Tell me a little bit more about.
Well, I've shared, the different breeds and sizes of dogs, and we really have individuals from every background and profession as well that participate in West Michigan Therapy Dog. I actually retired as the circuit court director and friend of the court, and I'm serving now as a county commissioner in Newaygo County.
Wonderful.
But we have the head of our training program is a psychologist that specializes in elder
How
care.
neat.
We have dog trainers. We have, I'm just trying to go through all of the different professions that we have. We have store owners. They're really as varied as our dogs are the professions that also volunteer with the organization. And everybody gives so much of their time and our own money to travel and to be able to do these things. We are a nonprofit organization, and you can donate to us through United Way. And every dollar that we receive is turned right back into the program.
That's excellent. And like I said, if you have the desire to give,
Yes.
and it doesn't matter what walk of life.
No.
If you love dogs and you have the desire to give, right? That's really all
true.
that matters.
We have training classes pretty much throughout the year, and we have a pre-screening program where the dog is tested for temperament and obedience. And even if you don't have a dog, we accept people into the program to help us. Or if people are interested in starting a program, they can contact us through our website
That's
and
fabulous.
indicate that they're interested in starting a program in their facility or organization.
Fabulous.
And if you want to contact our organization, you can do it through our website, and that is www.wmtd.clubexpress.com, and WMTD is West Michigan Therapy Dogs. You can just even Google that. And to contact us by phone, our phone number is 616-726-1256. Did you read that, Max? Can you see that?
Aw, how cute. What a cool program.
It is. It's just wonderful.
That's great. And
I tell everybody that there isn't a better day than me spending it with my dog and making people feel better.
what a super, I was going to ask you if you had a thought for people, and that right there is it. Oh,
Yes,
that's
it is.
wonderful. Thank you so much
very
for
welcome.
talking to us. And hey, I got a paw. Hi.
He's like, oh,
Hey,
I'm
thank
waking
you,
up.
Joe. You're waking up. You got this.
Good job.
Thank you once again, Barb, and
Thank
thank
you.
you, buddy. Thanks, Matt.
Two big dogs going up, one little dog going down. One green dog going up. The yellow dog is down. A red dog is out. One dog up.